It's not surprising that poor neighborhoods have fewer doctors. And it's not surprising that people who live there must rely on free clinics for much of their health care. But you may be surprised to learn who runs one of the few free clinics in South Los Angeles. Anna Cuevas has our story.
In a post-9/11 world, Americans tend to be wary of Muslims and the nature of the Islamic faith. But none of those fears are in evidence here.
In an environment where, unfortunately, you always hear that Muslim Americans or Islam preaches a lack of any value of human life, you are finding a project in South LA that's preserving human life.
Buenas tardes. ¿Cómo estás?
UMA Community Clinic was founded in 1996 by a group of UCLA medical students, all of them Muslim. It offers free and low-cost health care to area residents. Yasser Aman is president of UMA Clinic, which stands for University Muslim Medical Association, and he says the name UMA is more than an acronym.
The root word of Ummah is which means mother. And that's exactly the relationship that we would like to have with our patients. But the whole word means actually community.
Okay, good job.
UMA provides its patients with primary health care, including medications and screenings. It's one of only 7 clinics to serve nearly 1 million people in South LA. Stephen Murphy is UMA's medical director.
If they weren't coming here, they would be in the public ER. And when we count up providers per patients in this part of the city, it's 1 doctor for every 29,000 people.
It was the riots of 1992 that led to the creation of UMA. The clinic founders were all members of the Muslim Students Association at UCLA. The students were already involved in volunteer work, and they decided that South Los Angeles was the area that most needed their help.
There was this spirit of idealism that I think only comes with youth.
Razia Sheikh was one of the founding students.
We actually collected $150,000 in donations without having a site, without having anything concrete. People were willing to give us exam tables, computers, things that we would need based just upon the enthusiasm and an idea.
The group found an abandoned site for their clinic just blocks from Florence and Normandy, the infamous flashpoint of the riots.
When we found it, it was a completely dilapidated property.
The building was a former auto shop that had been used as a child care center.
And there was actually toxic waste underneath.
The group transformed this eyesore into the first Muslim clinic in the country.
One of the foundations of our faith is philanthropic work. Islam is based on 5 basic pillars. One of the basic pillars is you have to give in charity, and you have to help those who are in need. Not only that, you have to want for them and try to get to them what you have yourself.
Robinson? Only 2% of UMA's patients are Muslim. Most are from the South LA neighborhood, and about 73% are Latino and 17% African American. The clinic employees also come from diverse ethnic and religious backgrounds. Murphy, who is not Muslim, says he enjoys working in a faith-based clinic.
A clinic that's founded on, these faith principles has a leg to stand on. It's not going to go anywhere. It can get through hard times because it's guided by something more than just a business model. It's also guided by faith and the virtues that inspired the founders.
But does that faith ever restrict how the clinic's doctors practice medicine?
As Muslims, we are very specific on people's individual right to make their choices. We don't have any specific limitations, nor do we put it on any of our providers. In fact, Islam actually promotes helping people for the sake of the public health and public benefit. So we provide family planning. We provide, because we understand that that's a need, to help curb the spreading of sexually transmitted diseases is a community interest and a community benefit.
If anything, they see the clinic as a way to expose people in the community to Islam.
I knew a few Muslims, but I didn't know much about their religion and their background, and now I know a lot more, and I'm less judgmental.
Norma Arambula is a devout Christian who first came to UMA when she lost her job and health insurance.
I'm here to see Dr. Murphy. I pray that God will take me somewhere where I was going to be taken care of and where I was going to be treated like a person, not just like a number. And since the beginning, everybody treated me very nicely. I knew about different clinics in the neighborhood, but I was surprised to find such a clean and nicely stuffed clinic.
And they'll be calling you in a few minutes.
Thank you.
Okay?
The clinic handled 800 visits in its first year, and in just one decade, that number has grown to 7,000 a year. UMA board member Munaf Qadri was there from the very beginning.
Of course I wanted to do this. When I was asked, would you be interested in helping us? It was not even a question. It was when and not if.
It's the volunteer doctors that have helped keep the clinic going, along with medical students from the local universities.
Then I got 3 calls from students who were like, we want to work at UMA.
Okay, medical students?
Medical students. One is an undergraduate.
UMA's always put a high focus on education and training the next generation of doctors.
The idea is that not only do they serve the underserved population right now, but we want them to be inspired to go on in the future to serve the greater society.
But UMA's top priority is providing quality health care to anyone who needs it, regardless of ability to pay.
¿Qué es esto? Un circle.
We strive to become an organization that becomes a medical home for our patients, as opposed to the diagnose adios scenario that you see in many areas.
It doesn't matter if you're a drug addict, you still deserve respect. It doesn't matter if you're homeless, you still deserve respect. We've had a lot of homeless patients come through who've really appreciated the care that they've gotten.
From what I feel from this clinic is that it's a little heaven, a little piece of heaven in, I don't want to say hell, but in a very bad area where I feel safe.
I'm Ana Cuevas for Life in Times.
For more information on these and past healthcare stories, you can go to our website. Just go to kcet.org, click on Life in Times, and then the Health tab. And that's our program. I'm Val Zavala. Thanks for watching. We'll see you next time.